In my first semester of clinical, I was placed at a long-term care and rehabilitation facility. There I learned the fundamentals of nursing and spent most of my time with elderly patients. There is one situation in which I wish I could go back and use my psychiatric nursing toolbox that I have gained this semester. Each shift, my peers and I would assist the CNAs in feeding many of the residents who could no longer do so themselves. While my female patient was finished eating, a CNA came over to wheel her back to the living room to watch television. A male resident, who was also finished eating at that time, got up to walk out of the room at the same time. The CNA had misplaced a chair behind the male resident's back so she could move my patient's wheelchair, then proceeded to leave it there out of place. This then startled the man while he turned to walk, gasping as he lost his balance and cursing at his surprise. This CNA went over to the panicked resident and got up in his face, yelling about how he needs to watch himself and where he is going. She proceeded to aggressively explain that he needs to be reminded that he is not the only person in the room. She then stormed out of the dining room, swearing at the patient, making him more frightened than he already was. Not one other staff member asked how this man was doing and how he was feeling, myself included. This was extremely upsetting to me as I knew this elderly patient had depression and dementia. While learning about these two disorders with Dr. Jaslan's presentation and the textbook, I would change my actions or lack thereof if I had a scenario like this again in the future. This situation is a prime example of elder abuse, which is a prevalent issue in nursing care. In order to change how a similar situation is handled in the future, I would alter and develop a different plan of action for an elderly patient. First, I would initiate a therapeutic conversation about this situation alone, and in a private and quiet environment, not in the crowded and loud dining hall he was eating in. Although it is imperative that this conversation is just us two, it is important to remind oneself that it needs to be in an open area in case of emergency. As I had previously oriented myself with this patient earlier in the day, I know of his cognitive disabilities and will keep this in mind, providing care that is appropriate for this patient's mental capacity. If in the future I do not know of the patient's ability, I would offer myself and use a mini-cog assessment to do so. Following that, I would use neutral, non-judgmental questions that would encourage my patient to provide detailed information about his relationship with the staff member and possibly other employees to detect other signs of elder abuse. It is statistically shown that populations such as females, pregnant women, those with physical or mental disabilities, and the elderly are at greater risk for abuse and neglect than other patient populations that are not affected with these same disorders and conditions. Thus, when this patient is known to be both elderly and have mental disabilities, it is crucial we survey the client for other signs and symptoms of elder abuse. Once the initial interview and assessment is done to address the client's biopsychosocial needs, I would provide a safe and open environment for my abused or neglected patient. It is then vital to assess if this patient is in immediate danger from others, or to himself. Through therapeutically interviewing this patient, I would then create a safety plan which includes emergency information and education for the client, developing better goals of care, and arranging follow-up services for possible psychiatric counseling and other primary care visits. It is extremely important to use silence as this allows a patient, especially someone who may be confused or have dementia, to collect their thoughts and convey empathy toward the patient. In the article Detecting Elder Abuse and Neglect, Assessment and Intervention, Hoover and Polson discuss how the elderly population is continuing to increase, making it more important to understand your patient's history and current diagnoses, as this may affect their reactions to events in the present. This journal states that it is known that 1 out of every 10 elderly patients will encounter some sort of elder abuse in their lifetime, and many times, psychiatric conditions can mimic abuse. This reinstates the fact that it is vital that nurses know how to psychologically care for elderly patients so we can end the exploitation of the geriatric population. As nurses, we must use these psychological tools to listen, understand, and advocate for our patients, especially those who are elderly, have mental handicaps, and are at risk for abuse.